Hello, my name is Eesha Acharya. My project is the study of peri-implantation cytokines to identify molecular signatures, prognosis of pregnancy loss. Pregnancy loss affects about 15 to 25% of women, and almost 50% of pregnancy losses are unexplained. One possible cause of these miscarriages is inflammatory factors. Cytokines, inflammatory markers that circulate the bloodstream, modulate immune responses. One study by the journal Maternal Fetal and Neonatal Medicine proposes that successful pregnancies depend on a balance of different types of cytokines. I will be working with Dr. Lubna Paul and REI fellow Dr. Samantha Simpson. The institution that will run the study will be the Department of Obstetrics, Gynecology, and Reproductive Sciences at the Yale School of Medicine. Dr. Paul and I discussed different kinds of projects relating to women's health. I was drawn to this study because miscarriages take a significant toll emotionally on couples and families. The longer a pregnancy lasts before a miscarriage, the more devastating it is for a couple. If we can predict at the time positive pregnancy tests whether that pregnancy will continue or end in a miscarriage, we can help couples be better prepared to deal with the loss. At the start of this study, I helped with a literature review to understand cytokines and their possible role in pregnancies and miscarriages. I worked with Dr. Simpson to find studies that would help us to understand how to properly test cytokines. I will be helping with data analysis and writing the research paper. This study aims to identify the types of cytokine signatures around the time of embryo implantation that are predictive of pregnancy loss and to establish normative ratios and values for those cytokines. It will be different from most studies because it is a prospective cohort study. Also, it aims to look at women with in vitro fertilization, while most studies look at women with natural pregnancies. It is hypothesized that a signature cytokine assay collected at 5 to 6 weeks of pregnancy with first positive serum beta-HCG in infertility patients undergoing in vitro fertilization will be predictive of pregnancy loss. Women are enrolled at the time of the first beta-HCG serum check, which is 10 to 12 days after the embryo transfer. Demographic information and obstetric history will be collected. Women that are enrolled will be followed for pregnancy outcomes to include biochemical pregnancy, clinical pregnancy, and ongoing pregnancy versus pregnancy loss. Stored serum samples will be taken and analyzed to establish normative values or ratios for the cytokines that have been previously shown to be associated with the adverse pregnancy outcomes, including PD-L1, TNF-alpha, IL-10, and CXCL10 type cytokines. It is thought that PD-L1 is higher in healthy pregnancies, TNF-alpha attacks the embryo, and that CXCL10 and IL-10 help the embryo invade the maternal uterus. Then, we will attempt to validate these findings on a previously existing cohort of women who have normally conceived with known pregnancy outcomes. T-tests will be used to determine if cytokine values are significantly different between the healthy and pregnancy loss groups. Patients are only eligible if they have healthy singleton pregnancies, clinical losses with normal genetics, or biochemical pregnancies. In ongoing pregnancies versus pregnancy loss, IL-10 first and last draw levels were both statistically significant. Other cytokine levels are still inconclusive and more data is being collected.